Hey everybody, welcome to the module on the brain. And you see I got my Einstein hair going today because we're going to be talking about some brainiac kind of stuff. So you need to get into character if you're going to talk about brainiac stuff. So I'm rocking the Einstein hairdo. So anyway, why in the world is it important for counselors to understand any of this stuff? Why would I need to know anything about the brain? I'm not a physician. I'm not going to be a medical doctor who is going to be fooling with the brain and the nervous system and any of that kind of stuff. Well, I'll tell you. Counselors today need to understand the brain, if for nothing else, to be able to assess their clients and the need for medication. Well, why is that important? Well, medication is the wave of the future treatment of psychiatric illness and psychological illness. Just about every disorder is being addressed with medication or attempts to address disorders with medication are the future of the field. And so we are the first line of defense. Psychiatrists prescribe the medication, and they only see the client about once a month for typically 10 or 15 minute appointment just to assess whether the medication is working, whether it's doing what it's supposed to be doing. Then we see them for talk therapy once or twice a week in the intervening period. So what's going to happen if the person is not responding well to the medication? Who's going to see them first? Are they going to wait for a month with ill effects from the medication? Or is somebody going to be trained in how the brain works and what medication is about and how it does, so that I can observe in the office when they come and sit down with me any adverse side effects of the medication? And I'm the first line of defense, because the medication for psychotropic illness, psychological illness, and psychotropic medication causes side effects. All of it does. We're going to talk about that in a module a little bit later on psychotropic medication. But today we're going to lay down a little bit of information for you about the brain, how the brain works, how neurotransmission works, the basic neuroanatomy, some things that counselors need to know so that they can be aware of and looking for symptoms for various disorders, understanding what the brain is doing so they can intervene on the appropriate level with brain action, because we can influence that as counselors as well. Talk therapy influences that, relaxation, meditation, all kind of wonderful things. Mindfulness, all of it influences what happens in the brain. So it's important for us to understand. Also, you want to get out of this course with a B or better, so you have to learn it for that. No, that's not the answer. That's not what this is all about. What it's all about is you being the first line of defense, you being the people on the watchtower for assessment on whether medication is working, and you got to understand how it works in order for you to understand whether it's working or not and whether there's any kind of adverse side effects with that. So without further ado, watch this first video on basic neuroanatomy, and I'll come back in just a minute and discuss it and reinforce it, summarize it, and make sure everybody's got the salient points on the basic neuroanatomy.